J and nos INSK. Na this program, well body na gently. Mr. Coco
So, how will they look for breast cancer? How will they screen for breast cancer? It different depending on which country you dey. Now the USA different and group them of doctor and scientists, and then they put them aid them together, and they give we guideline them of what how often for screen. The most common screening now with mammogram, when a special kind X-ray where they look like the special X-ray of the body then for look for any lump then or bump then or thing then na the body way not normal waking signal say maybe cancer did it. So now the USA, the different group the way they give guideline then to we the doctor then they're not always they agree. Some then say we for begin for screen where you age 40. So they say no, wait till you age 50. Now, depending on your risk and you the person, you can talk to your doctor whether you for start 40 or whether you for wait 45 or 50 for begin screen. But either way, between the age of 40 and 50, most women they need for start for get mammogram for begin the screen for look for breast cancer. How often you for do that mammogram? Again, agreements not there too much now. Some they say every year, some they say every 2 years. But either way, go wrong with every year, go wrong with every 2 years. Now, something that they for talk to your doctor for see how often, how frequently you for they do your mammogram. And you can continue for do your mammogram whether not every year or every 2 years until you turn age 75 in America. Or even later, some people, if you dey in good health, you dey in good shape, and you expect and your doctor expects say you can live for another 10 years, even if you don't pass 75, you can continue for this do mammogram for check for breast cancer. So that is waiting that they recommend inside the US. Now some women they always they check them but be there every month, because now then they be we don't they teach before say every month check yourself for see if you get anything abnormal, any lump there and whatnot. So over the years they don't study this, they don't study this for see it really they help for me you catch breast cancer. It really they help for save women their life them. And overall then say it really not they add any more benefits for me you they do what they call self breast exam, or where the doctor they do clinical breast exam if you they do regular mammogram. So again, if na possible way they do regular mammogram, it no matter if you want for continue for the examine your breast every month, or if your doctor want for the examine your breast every month where you go for your annual checkup, that's fine. But if you not do one, not go begin to say, oh, hey, I not make them go check me bobby this month, I not check me bobby this month, or my doctor not been check me bobby where I go for my annual, that means saying a bad thing. No, it not mean that day at all. The most important thing though, where would they say is now for be breast aware, waiting and mean, know you bobby. Know what you bobby normally look like. Know what you bobby normally feel like. That way, if you notice anything way different from your normal, you talk to your doctor quick. Then they go able for do an exam and do other tests then for figure out. And the reason we say that most of the time where people like can find lump then at them bobby or find problem na them bobby, that now way that they do regular thing like they wash, that they put lotion. Now during that time and they can more likely for find them problem. Yeah. So if you know what your bobby look like and you pay attention, then you're more likely for pick something. And if you pick up something way not normal, talk to your doctor right away so that they go figure out, the right thing for do. Report any change to your doctor. So down the way then at the UK, the NHS then guideline then different from we within at USA. The UK then can tend for be more conservative, meaning they're not can do as much something than they as we can do na US. So now the UK they say for start screening where you age 50. So then the system different because they get insurance for everybody. Where you turn 50, as long as you register with GP, you go get notice for say, oh, you don't 50, or you need for start for do your mammogram. And then you go begin go do your mammogram. So you got for wait for me, they invite you. And they go give you that invitation there as long as you register with GP. So if you then at UK and you not register with GP, then you go miss out, because na that way they you go know, and na that way they the system set up for me you go do your mammogram. So very important, make sure say you get a GP, you register with them. Then na the UK, then every 3 years now in that they do the screening. Now it possible say not too long from now they get for change the guidelines then for do a little bit more frequently, and maybe the age they go decrease and small. Then scientists and then doctor then they review them 3 years so for come up with waiting at the best, because we they see say more and more people, especially a little bit younger than 50, they get breast cancer. And then right now they screen only until you age 70, not 75 like we na the USA. But if you na woman we don't 70, you don't pass 70, you want for continue for the screen, you can talk to your GP then, or your local units and call her. You can make a request to your local health unit for me, then continue for the screen you pass that age then. If you didn't have Scotland, the one they within have Scotland, they go extend to 75, but they know they extend beyond that day. Again, then say the same thing as we in the US, then say, be aware, be breast aware, know what your body look like, know what your body feel like normally. In between the mammogram, then they go pay attention to your body, not just for the take picture of the body, but they pay attention to what in the body feel like, so that if you feel anything abnormal or you see anything abnormal, you go talk to your GP quick, so that they go do something about that. So how would they diagnose breast cancer if somebody get breast cancer? So I talk say the first thing would they do screening mammogram, where you not see anything, you not notice anything, but you go check, once you reach that age day, you go check for me if they see anything. If they see something way abnormal by the screening mammogram, or if you feel something way abnormal na your body, and you go report to your doctor, they do what they call diagnostic mammogram. When a special kind mammogram where they really they focus na that area, they usai, you notice the problem for see what they go where they go there. So just like if they take camera then zoom in on that area, they for try for figure out. Also the thing where they can do after that mammogram, they now ultrasound. Do ultrasound na the body, na the area where the problem dey. And then the next way that they do na biopsy. Waiting a biopsy, now wait that they take needle, the side way abnormal, if na lump, the side way get the lump, then stick the needle there, then suck some of that tissue they come, from the needle. Then the doctor they look under microscope for see if then tissue, if then cell, then they look normal or not. If they not look normal, and they can do specific testing for see if na cancer 9 day na that body day. So now the most common way than the way we they diagnose breast cancer. Sometimes and they can send woman for go do MRI of them body, especially woman then where I said on they will get then young body then teenager body then way cack and tin up. Sometimes then the mammogram not really they able for penetrate through for me and see that area the way abnormal, or the body too big and too the tissue then too thick for me and see. So sometimes they will send that person there for go do MRI for because the MRI not just special kind of imaging test, special kind of picture then where they give you more information than the mammogram go give you. So how they treat breast cancer? So different treatments than they for breast cancer depending on the woman in age, the type of breast cancer, and in other health problem there. So if they find breast cancer, they send you to a breast surgeon and cancer doctor, a medical oncologist, and together they will come up with treatment plan. Usually that can include some kind of surgery, whether not for just remove the lump, the area outside, the breast cancer mass there. If now one way not don't spread, look like it don't spread anywhere else. Sometimes they need for remove the whole body, they call that the mastectomy. And then other treatments then depending on the stage of the cancer, whether the cancer don't, spread, to other parts, then sometimes they need for do chemotherapy. But bokutan and the need for do what they call hormonal therapy, where because breast cancer, the tissue then partner the breast, the bobby, then very sensitive to hormone, especially to estrogen. So boku breast cancer then now that estrogen then they feed the cancer. So that they give medication that will go block down the, and so it go basically starve the cancer, and the cancer go die, and the cancer cells will go die. Then we get other treatments what they call biologic therapy. Then we be say na medicine, then also chemotherapy. Now medicine the way they go prime you body immune system so that your body itself na in the kill the cancer, because we all body then to some degree get the ability for fight cancer, at least on a small scale. So what's in this they do now for basically, if you think about but war is like you they arm more soldier man then for go fight this warrior, so then the chance of success is higher. So whether they do the testing where somebody get breast cancer, they test for different genetic thing there and different marker then now the cancer for see which one per them medication has to go work best. And then the last type of treatment now radiation. Radiation a special kind of X-ray where be say we they use X-ray for find sick then, but we can use X-ray for treat sick then also. Whether they use X-ray for treat sick then a higher dose X-ray, and basically what they do now for go burn that then cancer tissue then they and kill them. So now the different type then of treatments, and then the waiting at the right treatment depend on the type of cancer, the woman, the stage of the cancer, how advanced it be, and waiting else they go on with the woman. But the treatment then so good nowadays, they're so much better than 10, 15, 20 years. More and more women then they survive now, cancer survivor then, whether they live normal long life, even though they don't get cancer at 50. I they take care of patients that we don't all 80, 90 years old will be get cancer at the age of 50 or 60 years old. That's how good the treatment they don't be. So no reason or day where somebody for with breast cancer, where boku man with breast cancer for they die because the treatments are good. But we need for pick up the cancer early, and you need for go for get the treatment early so that your chance for survive go be higher. So surgery, medication then, and radiation therapy now the three type of treatments then for breast cancer. So how for save life if for where it comes to breast cancer, early detection, meaning if the cancer they fena early, fena quick before it spread other side where it be say it more difficult for treat and it more expensive for treat if cancer don't begin spread. Early diagnosis, if you find something, go ahead and do the test then. No sit down, no wait, no delay. Make sure say you follow up so that they will find the cancer, do all the appropriate testing, and get you the correct diagnosis early. Once you get the diagnosis, go get treatment. Some man then afraid say, oh, once they diagnose you with cancer, that means say na die don't can. You own done. That not true. Like what they say, more women than they survive, more women than they live beyond breast cancer than before. So breast cancer not necessarily mean death sentence. The earlier you get treatment, the more likely you go survive that cancer day. Even one day where they present with more advanced cancer, then we get better treatments and for more advanced cancer than where they make people then they live longer life than before. So not accept early death, not accept and give up, say, oh well, this now, nine done so. Go get you mammogram. If you ever, be aware, be conscious of what your body normally for look like. If you find something, go seek help sooner. Go see doctor. Even if you get for cost you money, it better for me you go seek treatment sooner. So many programs then they for especially we were in America where we not get universal insurance. People that they worry about the cost of them test there. So Boku program then every state for people that will not get insurance for men then able for still get the mammogram. So check with you, local hospital. You can check with, with your doctor go on the internet, go on, cancer.org, American Cancer Society, then website, and look for resources and information for the area where you dey on how you go get your mammogram, especially October when a breast cancer awareness month. But who hospital and clinic then can get a mammo van, then where they go in a different community, then they offer free mammogram to women then we qualify. If you hear about them, they not say, oh, I got for go work, I'm busy, this, and I not put them off. Go get your mammogram and save your life. And if you're not breast cancer survivor, not shame for share your story. Talk about to other people and body so because now we community, especially within Salone people and African, we they die because we know one for talk. We know they tell other people and people that they shame, people that they worry about waiting other people that go think about them. Share your story if you're not breast cancer survivor, then you go help save somebody else in life. So now the word down the way I get for una. Thank you for listening to this program. Again, me na Dr. Mafudia with Well Bodi Salone and Well Bodi na Gentry. Follow we on YouTube. Subscribe to our YouTube channel. Make sure say you turn on notification. Then we they always add new video then every month on different topic. Then follow we on Facebook. Like we Facebook page. Follow we Facebook page. Follow we on Twitter, Instagram, all the different with social media outlets, and they share this video with you family then and help them make them get well body. Remember say this life now one in two no day. Well body nine the gently. If you get question then una can send to question then on our Facebook page, on Twitter, on Instagram, or even email we na wellbodisalone@gmail.com. Again, this is Dr. Mafudia Aswari. Thank you for waiting to watch the video. Stay tuned for our next video.